coming at the very end, and I will try to keep myself very short. So today we heard people from government talking from the public sector. We also heard people talking from the private sector. Now I want to talk as a citizen of this country, and I want to talk as a person. So my topic that I choose to speak on is called Healthcare No, Health Cure, the Sickness Business. So that is the topic on which I'll be talking about, more as an individual. So I always start my presentation with a small prayer. Please bear with me. Jnananandamayam devam nirmala spadhigakritim Adaram sarva vidyanam hayagriva upasmahe Saraswati namastubhyam varade kamarobini vidyarambam karishyamin sittir bhavatu me sada. So the agenda would be whether it is healthcare or health cure, transforming the care, and how digitization is playing a role in transforming the care. So let us define the terms. What does care mean? Care means we take action for something not to happen. Care is more like prevention. Cure always means something bad has happened and you are trying to bring it back to a normal state. So somebody is having a disease, you are curing them. And not having the disease is basically caring them. So there is a big difference between the care and the cure. And today's context, what I see as health care is nothing but cure. From morning till now, we have been talking about people having a disease and how we can cure it fast, how we can make sure that the recovery is quick. But one important aspect is how we can make people not have a disease and live in this world for the fullest they have given granted life by the God. So that indicates the current system of healthcare is not about care business, it is only about the cure business. There is a term WHO monitors every year. It's called disability adjusted life year. So the idea behind this particular term is when a person is born, the person is given a quota of life by God for the person to live to the fullest. We see some young infants die, young children die. So if they were given a quota of living till 85 to 90, they die at a very young age, which means their productive years of life is lost. Similarly, people lose their limb or because of stroke, because of various diseases like heart attack and other things, people lose their life, they are disabled, they become disabled, and they are not able to work at their fullest. So you have years of life lost to disability. So putting this together, we call it as disability adjusted life years. In other words, how much of productive life years the people are losing or the world is losing year on year. So let us do a quick analysis. In 2000, the population on the world is around 6.08 trillion. Today we are around 7.08 trillion. The life expectancy was 66.4. Today it is 70.5. The global expenditure on healthcare was 2.96 trillion. Today we are spending around 7.25 trillion, increased by almost 3 times. And the years lost to disability in 2000 was 1382.80 million, and today it is 2747.92, and the GDP has increased. So the real question is, if the investments in healthcare has increased by 3-folds, why people are getting more and more disabled? Life has increased by 4 years. Are they having productive life? So we are extending the life of the people, but is the life really enjoyed and the life is really worth? Where is all these investments going? If the investments are going in the right direction, why people are not able to live their life to the fullest? Our healthcare system is fundamentally flawed. The reason why is, if somebody wants to get an attention today, they have to become sick. They need to be diabetic. There should be infant mortality. There should be cancer. Why not we think of the world without any disease. And look at the amount of money that is being spent. 93% of the money is being spent only on cure, whereas only 7% is being spent on care. Where the focus should be and how the focus should be. And business today is based on the level of sickness. The higher the person gets sick, the more the revenue is in terms for the players. Should it not be otherwise? In olden days, my grandma used to say that she lived till 84. She said like, okay, once in a while, when she is very sick, the doctor will come home. But you see, almost every day the people are going to the doctor's place. So what has happened? So we are forgetting something, and our whole healthcare system has become a health cure system. It is fundamentally flawed. Think of the scenarios, what you would do. Your engine oil light is blinking in the car. Will you continue driving the car? The tire pressure signal is coming on the car dashboard. Will you continue driving your vehicle? Diesel generator is up for renewal. Will you continue running it? What is the cost of a car? A car may cost you anywhere from 5 lakh rupees to 1 crore rupees. For such a small value item, we are ready to do everything to take care of it. What is the cost of a human life? What is the cost of a human life if the person were to become APJ Abdul Kalam? Some estimates say we cannot put a price on human life. Some estimates say it costs trillions of dollars. If that is the case, why care is not happening? We all know prevention is better than cure. Do we take enough steps to prevent not having the disease and only focusing on the cure? Take India, world's #1 record holder with respect to road accidents. Now I am talking as a person. Almost every 3.4 minutes, one person in this country is dying in a road accident, and it has been steadily growing over the years. You can see the record there. Everybody knows wearing a helmet will save you from a traumatic brain injury. Government is campaigning for it, talking about it. But as citizens, have we taken the responsibility of wearing the helmet and wearing the seat belt when we are going on a vehicle? Cost of a helmet may be 1,500 rupees, but cost of a traumatic brain surgery, if you have a spinal cord broken, it will cost you around 15 lakhs. How much of insurance you have, still it will be an out-of-pocket expense. You may have to sell all the wealth that you have in order to get back to normal. Whereas if you have been taking care of the prevention, you could have saved it with just 1,500 rupees. Pollution. Every time when we have surgery, every time when we go to a hospital, there is a lot of biomedical waste that is creating. So every time there is a patient, you are going to create a lot of biomedical waste. Now, how we are going to dispose those biomedical waste? Look at the pollution, air, noise, and water. Today we have water, and you know there is a lot of fight going on between the states for water sharing. And in future it may become that, okay, water is going to be a very precious item and people will be ready to give their life for it. Our Prime Minister started a campaign called Swachh Bharat. We all talk about it, we all say about Swachh Bharat. But have we literally taken steps to clean our own neighborhood, or at least the trash that we are disposing? Are we disposing the trash in the proper way? As citizens, if we do our responsibility well, if we dispose the trash properly, and if we keep our place clean, we are not inviting chikungunya, or we are not inviting dengue, or we are not inviting any of these mosquitoes to spread the diseases for us. Water contamination. So every citizen has a responsibility to keep it clean. And if we as citizens do that, then we are bringing the disease burden of the country drastically down. So what is needed is to transform health cure to health care. Care is about prevention and promoting to being well. We should all aim to be healthy and happy. Why we want to have a disease and to be cured? If you can prevent, why go for cure? We have to encourage each and everyone to lead a life without diseases. Spend on happy activities. Spend on healthy food. Spend on sports. Spend on fitness. Spend on things that is going to keep you really happy. And together we can reduce the disease burden by monitoring your health regularly. So the reason why I gave you the dashboard example was, in a car, there is a dashboard that indicates what is happening with respect to the vehicle. Similarly, if you have a dashboard of your health and it constantly monitors and tells you what is happening with your health, and if your BP is coming somewhere around 135 by 79, you would know, okay, you are going to get into hypertensive stage, so that you can start monitoring it regularly. Your blood sugar is crossing more than 75 on fasting, you would know, yes, there is something going wrong with my health with respect to the sugar, so I may need to start dieting more and I have to do more exercising. Peter F. Drucker says, if you can't measure it, you cannot improve it. So regular health monitoring will take care of all these things for you, including reducing the disease burden. So this is where we American Megatrends come in. As an organization, we have built a set of medical grade wearable and portables, which we want to make it very affordable and which can be used anywhere across the globe without any AC power or anything. And using these devices, you can monitor almost all the health related parameters like BP, temperature, SpO2, glucose, cholesterol, hemoglobin, ECG, spirometer, and also set of things. So to know more about my product, we have a stall and we have the website, but I wanted to use this opportunity to basically talk about prevention, and prevention is always better than cure. So here is a small video of my product. I can. So from India, we took our Prime Minister's words literally. We wanted to make something in India, and we wanted to take it across the globe and show that India can do innovative stuff. So we participated in a global competition called Qualcomm Tricorder X Prize, which is a $10 million competition. And close to some 300 odd corporates attended that competition, and we are selected as one among the top 5. The other 4 people who are with us in this competition are 4 Harvard PhDs who have their own companies, and they are competing with us. As a first success, they gave us a milestone achievement award of $50,000, which we received very last week. So we are one among the top 5 now. So what are the benefits of our innovation? Is like we want to prevent chronic and lifestyle diseases. We want people to lead a healthy and happy life. And we want the people to live their life to the fullest with no compromises made. In other words, if you have the ability to lead a life without diseases, will you choose that path, or will you like to have a chronic disease and spend money on drugs and medication and always visiting the doctor to keep you hale and healthy? The choice is yours. So I'm going to skip all this. So finally, the takeaways is garbage in is garbage out. Whether it is your health or whether it is a computer, we always use the same term. So choose your food wisely. It will be the first step that you can take to keep you healthy. Prevention is always better than cure. Do preventive health checkup to know where you stand, and you can take care of your health much better. And of course, use monitoring devices to constantly monitor your health and keep a tab on it. Thank you very much, and thank you for the time.